You made it as a video question. Okay, so we used to think that weight loss was all we got from weight loss surgery, thus the name. So we said, gee whiz, if your diabetes gets better after a gastric bypass, it's purely weight loss. And if you were a really good person, you would diet and exercise and lose weight by eating fresh fruits and vegetables and legumes, and that's the right way that a good, strong person, good American would do it. Just push yourself back from the table and take up jogging. But there were some interesting findings that kind of raised questions about that. First of all, the diabetes in our patients gets better awfully quickly before they lose much weight. So some scientists in France said, let's compare diabetic mice. So you can find genetically obese diabetic mice. And they did gastric bypasses on the mice.
Really?
And then they watched their weight loss and they held back the food from another group of mice so that both of them lost the same amount of weight every week. And they looked at the diabetes in the two mice. If weight loss was it, then the resolution of diabetes in the two groups should be the same because they pair-fed the group to make sure the weight loss was the same. The cure of diabetes was not at all the same. The bypassed mice had much better, much higher resolution of their diabetes. And now we know why. When you bypass that upper part of the gut where the pancreas and the bile ducts and the gallbladder and the liver are connected, some other insulin-like glucose hormones, one called glucagon-like peptide 1 and the other one called gastrointestinal peptide, change radically after the bypass and quickly after the bypass. And they are involved with the control and resolution of diabetes after the surgery. So that the National Organization of Weight Loss Surgeons changed their name. Instead of calling themselves bariatric surgery, they now call themselves metabolic and bariatric surgeons because now we're looking to operate on thinner patients who maybe don't need weight loss but need to cure their diabetes anyways.
Because my understanding was before